Hello, I'm Dr. Russell Barkley. I'm a professor of psychiatry at the University of Massachusetts Medical Center in Worcester, Massachusetts. Oppositional defiant disorder, also known as ODD, is characterized by a pattern of negative, hostile, and defiant behavior lasting at least 6 months. Although it is common for children and parents to clash on occasion, ODD is marked by hundreds of negative interactions every day.
This videotape will describe what ODD is, what causes it, and why it should be treated. Dr. Barkley's model for treating ODD will also be briefly presented.
The goal of this program is to help clinicians and families understand the nature of oppositional defiant disorder, and in the process, increase the opportunities for positive outcomes for their children.
You can't come up to the side.
What do we mean by oppositional defiant disorder, and how is this different from typical childhood behavior? First of all, it's important to understand that ODD occurs in a continuum, ranging from mild noncompliance to outright defiance. Noncompliance generally describes a child's failure to respond to a reasonable request from a parent, such as cleaning a bedroom or similar tasks. Noncompliance is relatively passive in nature.
No, listen to this. Did you put the things away like I asked? The things that I handed you, the books. Did you put them away?
The more extreme behavior associated with ODD is defiance, which is a more active and frequently vocal refusal to comply with a reasonable request.
No, not clean my hands with it. I'm not going to. You know what? No.
Keep in mind that most children will behave in this way at one time or another. However, in children with ODD, it is the frequency and persistence of these behaviors that make them clinically significant.
What are the behaviors most commonly associated with ODD, and how often must they occur for a child to be considered oppositional?
According to the DSM-4, a child is considered to be oppositional defiant if 4 of the following behaviors are displayed on a regular basis for a period of at least 6 months. These include if the child loses his or her temper, argues with adults, defies or refuses an adult's requests or rules, deliberately annoys people, blames others for his or her own mistakes or misbehaviors, is touchy or easily annoyed by others, is angry and resentful, is spiteful or vindictive.
In addition to these behaviors, there may also be significant impairment in social skills, academic performance, and work-related problems if the child is employed. Keep in mind that these behaviors are indicators of ODD only if they occur more frequently than is usually seen in children of comparable age and developmental level.
These behaviors are used to define ODD, but there is more to the disorder that must be understood in order to fully comprehend it.
This program will not simply focus on child noncompliance or defiance, but on those social interactions in the family believed to have helped, at least partially, develop or sustain the child's oppositional behavior.
The nature of ODD is not adequately described by the behaviors children display. The manner in which parents react to those behaviors is equally significant. There is a very important aspect of ODD that also needs to be discussed in order to better understand the disorder. ODD is closely linked with attention deficit hyperactivity disorder. In fact, the majority of children with ODD also have ADHD as a comorbid condition. To help explain the nature of ODD and the impact the disorder has on parents and children, several people have generously agreed to participate in the making of this videotape.
Christopher? Is that allowed in the house? No. So where do you think he needs to go now?
Christopher is 9 years old and has ODD. Both he and his brother Matthew have also been diagnosed with ADHD.
Thank you.
Their mother, Susan, is a single working parent. She has a close relationship with her sons,
But you forgot to close the door.
but finds the experience of raising them trying.
Excuse me. See this? You forgot something. It was very frustrating to have children who you just couldn't seem to have control over. And it was like questioning your parenting skills, questioning what am I doing wrong. I've got to be doing something wrong. I don't have children who listen to me. I don't have children who will do a simple task.
I would suggest lowering it a little bit. Sugar will burn.
Valerie is 12 years old. She was also diagnosed with ADHD. Valerie also has oppositional defiant disorder.
You. Do you know what you mean?
Now, which one are you going to do? You're going to jump for Martha?
ADHD is one thing, but the oppositional behavior problems at home, another thing. And I think it makes it even more complex.
What is the difference between non-compliance and defiance?
Or you can get the electric little thing.
A child's behavior is considered non-compliant when he or she fails to appropriately respond to an adult's reasonable request within an acceptable period of time. For example, 15 seconds after the request or command is given. A child is also considered non-compliant when he or she fails to follow through on a request. And finally, non-compliance includes the failure to follow previously taught rules of conduct, such as leaving their desk in class without permission, running off in a department store, lying or stealing, or hitting and swearing.
Hey, Chris, I need you to put them down so we can leave. Come on.
Recognizing oppositional defiant disorder is difficult, since many children exhibit these behaviors at some time or other.
Over here. Matthew, they're really hyper. Touching everything. Now, pick up that piece that you're stepping on. I actually thought that it was typical at first, instead of, yeah, well, there's a problem. Go right there to the door, please. Come on. Now pick it up. That is not okay. So it was like I didn't take them out in public. I would do everything I could to stay home because I was embarrassed at behavior, at their behavior. And then at mine because I was yelling in a public
Defiance describes a situation wherein the child displays active resistance to a parent's reasonable request.
We got a leafy deck over here.
No.
Oh, yes.
No.
We're going to sweep it off.
This resistance may take the form of verbal refusal, temper outbursts, or sometimes physical aggression toward the parent.
As a young child, she was very aggressive. She was the one that would push or grab a toy away, which, you know, when you're two, that is basically typical behavior, but she really never outgrew that.
What did I tell you? You told me you were hungry.
Because it is difficult for parents to know whether a child's behavior is typical or not, seeking outside intervention may be a difficult decision for them to make.
When should a parent consider seeking help for their child? Remember that some non-compliant or defiant behavior is normal for children, particularly those in the preschool age group. It should not be thought of as abnormal and does not justify treatment. However, if at least two of the following conditions are present, then a child may be in need of clinical intervention.
First, the child's behavior is developmentally inappropriate and occurs to a far greater degree than is common for children of this age group.
This is usually established by having the parent fill out a form about the child's behavior, since the child is likely to be at his or her worst in the home setting.
Examples of this type of assessment form can be found in the manual that accompanies this videotape.
Similar reports from teachers may also be used to evaluate the developmental inappropriateness of the child's behavior. Additionally, the parent may be interviewed to see if the child displays symptoms of oppositional defiant disorder.
Second, the child's behavior is causing an appreciable degree of impairment.
This means that the child's behavior is interfering with their capacity to meet age-appropriate expectations. This includes self-care, trust and independence, interactions with family members and peers, acceptance of age-appropriate responsibilities, such as chores and homework, and the ability to follow through on rules without supervision.
Third, the child's behavior is resulting in a significant emotional distress or harm, either for the child or, more likely, for the parents, siblings, or peers.
This may be established by evaluating whether the child is unhappy with the state of affairs in the family or in their social life. Problems with parents and peers can be measured by inquiring of family members and teachers. But keep in mind, many times young children may not be unhappy or distressed by their own defiant behavior because it gets them what they want in the short run. But in the long run, such behavior brings harm to the child in many ways, including greater family conflict, loss of friends, poor school performance, and even risk for injury.
Christopher and Valerie's parents have sought outside help. This has enabled them to better understand their children's difficulties and, at the same time, to appreciate their positive attributes.
Gives more to clean up, you know. Okay. She is a bright girl. She is smart. She has a lot to offer. And if she is guided in the right direction, she has so much potential. And I see good things, but she needs help along the way.
She's a very intelligent person. And I think she's going to be able to apply that intelligence to herself and use it to help herself even more to get through these problems.
Christopher is very active, very easygoing kid. He interacts really well with kids. He's a very sweet, huggable, lovable little boy. Loves cuddle time. That's a definite every day. Have to do it. It means a lot to him.
It is important to differentiate typical childhood behavior from ODD because once recognized and addressed, it is likely that other problems may be revealed as well. These include attention deficit hyperactivity disorder, conduct disorder, school underachievement and learning disabilities, poor social skills and peer relations, post-traumatic stress disorder, and depression. While these associated problems are serious in and of themselves, attending to the behaviors directly associated with ODD will often bring about improvements in these areas as well. Once oppositional defiant disorder is recognized, it is very important to seek treatment, not only for the welfare of the child, but for the parent as well.
The disorder was once described in this way. Like a glacier, the behaviors that make up ODD move very slowly, but they can have a devastating long-term effect on the landscape of the child and family's life.
No, Christopher, look what you're doing, please.
The roots of oppositional defiant disorder are multiple.
Excuse me. What? Eye care. Now, can you get that knot out of there? Without breaking your lace?
The question often raised is, does ODD result from poor parenting, or are some children born this way? The answer is that ODD seems to arise from a combination of both the parent's temperament and the child's.
You forgot to cross it over.
I'll do that.
Okay. I doubted my own parenting skills. If I was a good parent, if I was doing what I had been doing all along with my other children, if I was doing anything right.
While there is a strong connection between the quality of the parent-child relationship and oppositional defiant disorder, it would be unfair to characterize it as simply and solely reflecting ineffective parenting abilities. In fact, ODD usually arises only when a particular combination of circumstances occurs.
To explain the underlying causes of oppositional defiant disorder, Dr. Barkley uses a 4-factor model. The first factor is the parent's temperament. Non-compliance in children often occurs if parents rely on inconsistent strategies that do not provide sufficient reinforcement for positive behaviors.
Through inconsistent consequences given by parents, children achieve periodic success at avoiding demands. This, in turn, reinforces the child's use of oppositional or coercive behavior. This can create a vicious cycle in which the child's defiant behavior feeds back and further adversely affects the parent's mood, sense of confidence, and self-esteem.
You know what? It's early. If we were at home, you wouldn't be eating yet either. Okay? I do not always respond very calm, cool, and collected to my children. I yell, because by the time I've said something 20 times, there is no calm about it. And so what you have on film is not the way I always am with them.
Children with difficult temperaments are likely to become more resistant when demands are made of them. Parents with similar temperaments become equally frustrated when their children refuse to comply. This interaction of incompatible temperaments is often the first step in the development of oppositional defiant disorder. The second factor in this model is the temperament of the child.
You said by Friday. What's today?
Are we a day off?
Yes.
Temperament is something we are born with, and there are children who are innately prone to highly emotional responses, or are highly active, inattentive, and impulsive, common behaviors for children who have ADHD.
I'd say when she was 2 or 3 years old is when I first felt that there was something really wrong. And then we went through a series of doctors and psychiatrists and analysts to help us figure out what was wrong. And finally, one of them thought that it might be ADHD. And then when that person started describing the conditions, I said, that's it. That's what it is.
Symptoms of attention deficit hyperactivity disorder, such as overactivity, inattention, and impulsiveness, are aspects of temperament that can be seen very easily in early childhood. But should these behaviors persist into the later school years, they are more likely to create parent-child interaction conflicts.
She was becoming very physical with the people in her family, constantly hitting, pushing, just looking for stimulation. I never associated her bad behavior, the impulses. I thought ADHD was a learning problem, but I understood now her behavior problem and why she needed to be stimulated all the time. And I learned a lot.
Understanding the role of the child's temperament in the development of ODD can contribute to improved relations between parent and child.
I have learned a lot to anticipate her reaction, so I can judge how I'm going to handle things actually before they start. If it's been a trying day and I just anticipate the escalation, then I can avoid the situation altogether. She is very receptive. She likes warmth and she likes the physical comfort. So that helps a lot.
The next factor in this four-factor model is the level of the parent's child management skills. This is particularly true when parents do not adequately monitor their children's activities.
I see something. See the jacket, yes. Where do you think I would like that put? It gets very frustrating to have to repeat yourself time and time and time again. And you pretty much have to move yourself to move your children. You have to get up and physically walk with them to make sure that they get the task done. Whether it's a simple brush your teeth or now it's time to go to bed. Shirt drawer. You know, please put your clothes away. Normally I did, all in one drawer. Or he didn't, and they're there half an hour later because I didn't go check. Unfortunately, I have learned through trial and error that that's not the way to raise children. You do this side, and I'll do this side, okay?
Non-compliance can be an effective method for avoiding unpleasant tasks. However, adequate monitoring of the child after a request is made may increase compliance.
Oh, yeah, just like that.
You do have to draw a line, set limits,
Thank you, dear.
and stay consistent with the limits you set. You know, if he didn't brush his teeth, he'd know. I would get up and check his teeth or walk him back to the bathroom and stand there while he did. He didn't take care of his laundry, I would stand there while he did. So there was no getting away from not doing what he was told to do.
Finally, there are outside factors that can negatively impact on the parent-child relationship.
Events surrounding the family, both internal and external, can create or contribute to increased risks for child-defiant behavior.
For example, single parenting and the social isolation that often accompanies that is one such factor. Marital discord has also been linked to disruptive and defiant behavior, and the stress of economic status and social adversity can increase irritability in parents, putting children at further risk for developing and sustaining oppositional behavior. Most of the families referred for treatment of ODD will exhibit one or more of these characteristics.
Come on.
There are many well-established reasons for choosing defiance and its underlying family interactions as the focus of intervention. Among these are the increased risk for the following predicaments in which these children may find themselves.
These are school underachievement, poor peer relations, delinquency, substance abuse, school expulsion or dropping out, antisocial personality disorder, and adult underemployment. Besides the potential for these future outcomes, there are other significant reasons for targeting defiance in children.
First, noncompliance or defiance in various forms appears to be the most frequent complaint of families referring children, especially boys, to child mental health centers. Over half of all referrals to such clinics are for oppositional or aggressive behavior, and this figure rises to more than 74% if symptoms of ADHD are included. Second, noncompliance underlies the majority of negative interactions between family members and the referred child. A third reason for selecting noncompliance as a target is its greater pervasiveness across settings compared to other behavioral problems seen in children. Fourth, noncompliant behavior may have indirect effects on family functioning that may come back to detrimentally affect the psychological adjustment of the defiant child. As noted already, out of this impaired family management process, the child rapidly acquires a set of behaviors to use against the parent and other family members, or even peers, when they are instructed to do something they do not like to do. Finally, noncompliance and defiant behavior in children appears to be highly stable over time, significantly predicting the persistence of this behavior pattern into adolescence. Childhood defiance, or aggressiveness, in fact, may be one of the most stable childhood behavioral disorders across development.
There is a clear correlation between oppositional defiant disorder and other behavioral problems. Research shows that children with ADHD who are not adequately treated make up 80% of those diagnosed with ODD by age 12. Children with ODD who are not adequately treated make up nearly 50% of those diagnosed with conduct disorder by age 16. And children with conduct disorder who are not adequately treated go on to form the majority of those diagnosed with antisocial personality disorder as young adults, manifested by highly aggressive and sometimes criminal behaviors.
As you can see, there is a significant correlation between early ADHD, the development of oppositional defiant disorder, and increasingly more difficult behaviors as these children mature. In this program, I have explained the nature of oppositional defiant disorder, its causes, and the compelling need to address these problems at the earliest possible stages in the child's development. But what can be done to accomplish this?
One night I was working with her and I was tired and I was getting very kind of silly and she was just eating it right up. We were just sitting there laughing about things, and it's really changing things between us.
There are a number of strategies that parents can employ to help them deal more effectively with their non-compliant and defiant children. These strategies are usually taught in a series of parent training sessions conducted by mental health professionals who specialize in family dynamics. Dr. Gwen Edwards conducts training programs for parents of ODD children at the University of Massachusetts Medical Center.
We know from not only the clinics here in our facility, but from other mental health clinics around the country, that the most common reason that a parent will take a child to a mental health clinic is because of behavior problems. It is the most common reason why people ask for help. And the initial event that led them to ask for help often is because they just really can't deal with the situation anymore themselves. Parents end up feeling embarrassed or self-conscious because they can't take their child into public places without embarrassing things happen. They're hearing from teachers in school that the child's behavior is disrespectful or they're violating rules in school. And so they come requesting help because they finally reach the point where things that they've done just simply aren't helping anymore.
Alex and Jim are the parents of a young boy who was diagnosed with ODD. Like many of these children, their son George also has ADHD.
When you have an ADHD child, you find yourself kind of isolated. And, you know, if you go to public places and the child acts up, you know, you get the stares and the treatment of what's wrong with that kid, what's wrong with that couple, why don't they control that kid? And just to know that there's other people that experience the same thing and how they deal with it has been, for my mental health, tremendous.
Our son's also ODD, too, so he has the oppositional defiant disorder. So just when you request anything, it's never, he just does it. He'll come back to you with something very negative or just downright mean, and you take a step back and say, what brought this on? Why is he treating us like this? He doesn't know why he's treating us like this. He can't figure that out, but it's up to us to manage that, to help see it, point it out to him, and correct it. So that's what we've been working in here with. It.
Sessions like these teach parents how to break the cycle of defiant behavior and inappropriate parental reactions. They are carefully planned out over a series of weeks and months. In each session, parents are given specific tools and techniques to apply, and these are reviewed at subsequent sessions. There is also time for parents to discuss their successes, as well as any problems encountered since the previous meeting. Parent training programs such as this can be found in virtually all parts of the country.
A lot of parents enter our parent training program wondering why they're the ones in counseling or in treatment, and will often ask, well, why isn't my child in treatment? Why isn't my child in counseling? And what I tell them is that the goal of treatment is to change them. And if they change, their child will change. The goal of our program is to change the parents' way of managing their child. So I'm after, ultimately, behavior change in the child, but I do so by way of changing the way that parents typically interact with their child. Well, that's what I'm after, is for all of you to become so familiar and so comfortable with doing this that it's second nature to you.
The principles of managing oppositional behavior are only briefly addressed in this program. If you would like more information, please know that there is a companion videotape, Managing the Defiant Child. In that program, the principles of parent training are examined, demonstrated, and discussed in far greater detail. Children become defiant in order to avoid performing unwanted requests from their parents. In turn, parents escalate their own negative behavior toward the child in an effort to stop unwanted behaviors and get the child to comply. By understanding the nature of oppositional defiant disorder, parents may not only improve their child management skills, but also enhance the quality of the relationship with their children.
You can't do that, because that's a dangerous thing. Okay? You have to say what you mean and mean what you say, and once they learn that, and it's not going to be overnight, it's going to take a couple months, but if you say what you mean and mean what you say and follow up what you say, that's what changes the behavior. It's very tiring, but yet very rewarding in the long end. to see that the progress that's been made. To know that I can tell him to do a simple task and have him do it.
Mm.
You do it.
I think it's just about them. The best advice I ever learned was that if you want to change something in your child, you have to change yourself first. And I was willing to do it. This is my job, and it makes me feel good about myself to be able to react to her positively. And it teaches me how to respond really to the basic family and the other children as well. We all gain from it.
You made a picture.
That's what Dad got me. Uh-huh.